In this video, I'm about to show you how the Department of Justice just exposed 93 medical professionals in a single nationwide crackdown. Doctors, nurses, pharmacists, clinic owners, all charged with healthcare fraud, all accused of stealing from Medicare and Medicaid. We're talking about $1.4 billion in fake claims, opioid pill mills, telemedicine fraud, home health schemes, and patients who were treated like ATMs. These weren't small-time operators. These were people you trusted with your health, people who took an oath, people who swore to do no harm. The feds just dropped the hammer, and trust me, it's gonna make you sick. Let's get into it. Let me start with the numbers. The DOJ just announced charges against 93 medical professionals across the United States. 93 people: doctors, nurses, pharmacists, licensed clinical social workers, physical therapists, podiatrists, and clinic owners. The total amount of alleged fraud, $1.4 billion. $1.4 billion. That's not a typo. Billion with a B. These defendants are from all over the country: Florida, Texas, California, New York, Michigan, Ohio, Georgia, Illinois, Pennsylvania, New Jersey, Tennessee, Alabama, 19 states in total. The DOJ called it the 2025 National Healthcare Fraud Enforcement Action, and it's one of the largest in history, focusing specifically on medical professionals, not just fraudsters, not just criminals. Licensed medical professionals who took an oath to do no harm, people who went to medical school, people who passed boards, people who had DEA licenses, people who patients trusted with their lives, and they threw it all away for money. Let me put that number in perspective. $1.4 billion could fund a community health center for 20 years. It could pay for cancer treatment for 50,000 patients. It could buy ambulances for every rural county in America. It could vaccinate 14 million children. Instead, it bought Ferraris and beach houses for people who already had plenty. People who didn't need the money, people who were already wealthy, they just wanted more. The Attorney General held a press conference. She said, and I quote, "These defendants betrayed the trust of their patients and the American people. They used their medical licenses as weapons to steal from the vulnerable." The DOJ seized over $80 million in cash and assets. They executed search warrants at 40 locations across the country, and they're still investigating. But here's what the press release doesn't tell you: the stories behind the numbers, the individual cases, the doctors who wrote prescriptions for patients they never met, the nurses who billed for home visits that never happened, the pharmacists who filled fake orders by the thousands. These aren't just statistics. These are real people who got rich while patients suffered. Real patients who needed help and got nothing. Real families who were destroyed by addiction while doctors counted their cash. Let me tell you about a few of them. Let me start in Florida, because Florida is ground zero for this kind of fraud. Always has been. A doctor named Dr. Anthony R. Marino operated a pain management clinic in Fort Lauderdale called Marino Pain Institute. From the outside, it looked legitimate. Waiting room, exam rooms, receptionist. The whole setup? But here's what was really happening. Dr. Marino was writing prescriptions for oxycodone, hydrocodone, and fentanyl to patients who didn't need them. He would see up to 50 patients a day, 5 minutes per patient. No physical exam, no medical records, just write a prescription and move to the next patient. The patients paid in cash, $200 per visit, no insurance accepted, and then they would sell the pills on the street. The DEA flagged Dr. Marino in 2022. They noticed that he was prescribing more opioids than any other doctor in Broward County. The DOJ's investigation found that Dr. Marino wrote over 25,000 opioid prescriptions between 2020 and 2024. That's an average of 17 prescriptions per day. He billed Medicare for over $1.2 million. The government paid out $1.2 million. The government paid out $1.7 million before anybody stopped him. Dr. Marino used the money to buy a mansion in Boca Raton, a Porsche, a boat. He was arrested in February 2025. He's facing 25 years in federal prison. His medical license has been suspended. Let me take you to Texas. A ring of doctors operated a massive telemedicine fraud scheme. The ringleader was a doctor named Dr. Sarah J. Chen. She was a licensed physician in Houston, board certified in family medicine, and she never saw a single patient in person. Here's how it worked. Dr. Chen owned a telemedicine company called Telecare Solutions TX. She hired call center workers in the Philippines to call Medicare beneficiaries. The workers would say, "Free telehealth consultation, covered by Medicare, no cost to you." The patients would agree. They would talk to a call center worker, not a doctor. The worker would ask a few questions. Do you have back pain, knee pain, diabetes? Then the worker would generate a prescription for a back brace, knee brace, or diabetic supplies. Dr. Chen would sign off on it without ever talking to the patient. Then the ring would bill Medicare. The DOJ found that Dr. Chen signed off on over 15,000 prescriptions for patients she never met. She made over $3 million in 2 years just for signing her name. One patient, an elderly woman in Dallas, received a back brace in the mail that she never ordered. She called the number on the box. It was disconnected. She threw the brace in the closet. 2 months later, she got a bill from Medicare for $1,800. She spent hours on the phone trying to figure out what happened. She never got an answer. She was charged for a brace she never asked for, never received, and never used. She had to dispute the charge with Medicare. It took her 6 months to resolve. 6 months of stress over something she never did. Dr. Chen was arrested in January 2025. She's facing 15 years. Her medical license is gone. Her house is forfeit. Let me take you to Michigan. This one is particularly disgusting. A woman named Barbara L. Miller was a licensed practical nurse. She owned a nursing home in Detroit called Miller's Care Center. She billed Medicaid for services that never happened. Physical therapy, occupational therapy, speech therapy, none of it was provided. The nursing home was understaffed. The patients didn't get the care they needed. Bed sores, infections, falls, some patients died. But Miller kept billing. The DOJ found that Miller's nursing home submitted over $25 million in claims. Medicaid paid out $225 million in claims. Medicaid paid out $116 million before anybody stopped her. Miller used the money to buy a house in Florida, a Cadillac, a boat. She also paid herself a salary of $500,000 per year. One former employee, a certified nursing assistant named Doris R. Jackson testified that she was told to document therapy that never happened. She said she was told to bill for 6 0-minute sessions when we only had 10 minutes with the patient. Doris quit. She filed a whistleblower complaint. She's going to get a percentage of what the government recovers. Barbara Miller was arrested in December 2024. She's facing 20 years. Her nursing home has been shut down. Let me take you to California. A ring of pharmacists operated a massive pharmacy fraud scheme. The ringleader was a pharmacist named David K. Lee. He owned a chain of pharmacies in Los Angeles called Lee's Pharmacy Group. He billed Medicare for expensive HIV and cancer medications that were never dispensed. Here's how it worked. Lee would buy patient information from data brokers. He would submit claims for medications using those patients' names. Then he would have a pharmacist verify that the medication was dispensed. It wasn't. The DOJ found that Lee's pharmacies submitted over 75 million times in claims. Medicare paid out not 75 million times in claims. Medicare paid out not 45 million before anybody stopped him. Lee used the money to buy a house in Beverly Hills, a Ferrari, a vacation home in Cabo San Lucas. He also sent money to relatives in South Korea. Over $15 million was wired overseas. Lee was arrested in November 2024. He's facing 20 years. His pharmacies have been shut down. Let me take you to New York. A ring of home health agency owners operated a massive home health fraud scheme. The ringleader was a woman named Maria G. Santos. She owned 3 home health agencies in Queens. She recruited Medicare beneficiaries and billed for home health visits that never happened. Here's how it worked. Santos would pay patients $100 to sign up for home health services. The patients would sign, they would give their Medicare information, then Santos would bill Medicare for 20 hours of home health aid services per week, but no aid ever showed up. The DOJ found that Santos's agencies submitted over $55 million in claims. Medicare paid out million in claims. Medicare paid out million before anybody stopped her. One patient, an elderly man in Queens named Thomas R. Bennett, testified that he signed up because he needed help with cooking and cleaning. He waited for an aide. No one ever came. He called the agency. They said, "We're processing your paperwork." He never received any help. but Medicare was billed for 20 hours a week for 2 years. Thomas told an FBI agent, "I trusted them. I thought they were helping. I never imagined someone would lie about something like this." Santos was arrested in October 2024. She's facing 18 years. Let me take you to Georgia. A ring of psychiatrists operated a massive psychiatric fraud scheme. The ringleader was a doctor named Dr. Michael R. Thompson. He owned a chain of psychiatric clinics in Atlanta called Thompson Behavioral Health. He billed Medicare for intensive psychiatric services that never happened. Group therapy, individual counseling, family therapy. None of it happened. The DOJ found that Dr. Thompson's clinics submitted over $40 million in claims. Medicare paid out $40 million in claims. Medicare paid out $25 million before anybody stopped him. Here's how they recruited patients. They went to homeless shelters and offered people $50 to come to the clinic and fill out some paperwork. The homeless people would come, they would give their Medicaid information, they would sit in a waiting room for an hour. Then they would get $50 to come to the clinic and fill out some paperwork. The homeless people would come, they would give their Medicaid information. They would sit in a waiting room for an hour, then they would get $50 cash and leave. They never received any treatment. Dr. Thompson was arrested in September 2024. He's facing 15 years. His medical license is gone. Let me tell you about another case from this takedown. This one happened in Illinois. A ring of physical therapists operated a massive physical therapy fraud scheme. The ringleader was a physical therapist named Jennifer L. Taylor. She owned a chain of clinics in Chicago called Taylor Physical Therapy Group. Here's what they did. They billed Medicare for physical therapy sessions that never happened. They would schedule patients, take their insurance information, and then never provide the treatment. The DOJ found that Taylor's clinics submitted over 30 million point-in claims. Medicare paid out 30 million point-in claims. Medicare paid out $18 million before anybody stopped her. One former employee, a physical therapy assistant named Michelle R. Davis, testified that she was told to document 6 0-minute sessions when we only had 15 minutes with the patient. Michelle quit. She filed a whistleblower complaint. She's going to get a percentage of what the government recovers. Jennifer Taylor was arrested in March 2025. She's facing 12 years. Her clinics have been shut down. Let me tell you about another case from this takedown. This one happened in Pennsylvania. A ring of podiatrists operated a massive podiatry fraud scheme. The ringleader was a podiatrist named Dr. Jonathan R. Miller, no relation to Barbara Miller from Michigan. He owned a chain of foot clinics in Philadelphia called Miller Foot and Ankle Centers. Here's what they did. They billed Medicare for unnecessary procedures, toenail removals, wound debridements, orthotic inserts. None of it was medically necessary. They would convince elderly patients to sign up for procedures they didn't need. The DOJ found that Dr. Miller's clinics submitted over 22 million cents in claims. Medicare paid out 22 million cents in claims. Medicare paid out 14 million before anybody stopped him. Dr. Miller used the money to buy a house in the mainline suburbs of Philadelphia, a Mercedes-Benz, a vacation home in the Poconos. One patient, an elderly woman in Philadelphia named Eleanor R. Franklin, testified that Dr. Miller told her she needed surgery on her toe. She didn't. She went to another podiatrist for a second opinion. The other podiatrist said, "There's nothing wrong with your toe. You don't need surgery." Eleanor avoided unnecessary surgery, but Medicare was still billed for consultations and procedures that never happened. Dr. Miller was arrested in February 2025. He's facing 10 years. His medical license has been suspended. Every one of these fraud rings was exposed by a whistleblower, someone who worked at the company, someone who saw the fraud, someone who had the courage to speak up. These people risked everything. Their jobs, their livelihoods, their safety. Some of them were threatened, some of them were harassed, some of them were blackballed from their industries, but they spoke up anyway. In the Florida pill mill case, the whistleblower was Rosa M. Delgado. She was a medical assistant at Dr. Marino's clinic. She saw the 5-minute appointments, the cash payments, the fake medical records. She quit and filed a qui tam complaint. In the Texas telemedicine case, the whistleblower was Dr. Alan K. Schwartz. He was a physician who was approached by Dr. Chen's fraud ring. They offered him $20 per prescription to sign off on fake orders. He said no, and then he reported them. In the Michigan nursing home case, the whistleblower was Doris R. Jackson. She was a CNA at Miller's Care Center. She saw the understaffing, the lack of care, the fake documentation. She quit and filed a complaint. In the Illinois physical therapy case, the whistleblower was Michelle R. Davis. She was a physical therapy assistant. She saw the fake documentation, the minimal treatment, the fraudulent billing. She quit and filed a complaint. In the Pennsylvania podiatry case, the whistleblower was Linda S. Parker. She was a medical receptionist at Dr. Miller's clinic. She saw the unnecessary procedures, the elderly patients being pressured into surgery. She quit and filed a complaint. These people are heroes. The False Claims Act allows whistleblowers to get between 15% and 25% of what the government recovers. Rosa Delgado is going to get millions. She deserves every penny. But the money isn't why they did it. They did it because it was the right thing to do. They did it because they couldn't look at themselves in the mirror if they stayed quiet. Here's why I made this video. To warn you, if you are on Medicare or Medicaid, look at your statements every single month. The government mails them to you. They also post them online. Take 15 minutes at the beginning of each month and go through them line by line. Don't just throw them in the drawer, read them. Look for anything that doesn't make sense. A provider you don't know, a service you never received, a prescription you never ordered, a date you weren't even at a doctor's office, a procedure you never agreed to. If you see a charge for a service you never received, a prescription you never ordered, a visit that never happened, report it. Call the HHS Office of Inspector General. The number is 1-800-HHSTIPS. That's 1-800-447-8477. Write it down, put it on your refrigerator, share it with your family, share it with your neighbors, put it in your phone contacts. The fraudsters rely on you not paying attention. They rely on you throwing your statements in the trash. They rely on you assuming that everything is legitimate. They rely on you being too busy, too tired, too trusting. You can be the check on that system because you pay attention, because you read your mail, because when you see something wrong, you pick up the phone. One phone call can stop a fraud ring. One phone call can save millions of taxpayer dollars. One phone call can protect your neighbors, your parents, your grandparents. 93 medical professionals. $1.4 billion in fraud. Because whistleblowers spoke up. Because investigators did their jobs. Because people like you paid attention. Don't let your tax dollars buy someone else's Ferrari or beach house or boat or penthouse. Before I let you go, I want to leave you with this. Dr. Anthony Marino is in prison, Dr. Sarah Chen is in prison, Barbara Miller is in prison, David Lee is in prison, Maria Santos is in prison, Dr. Michael Thompson is in prison, Jennifer Taylor is in prison, Dr. Jonathan Miller is in prison. Their mansions are gone, their Ferraris are gone, their Porsches are gone, their boats are gone, their Mercedes-Benzes are gone, their vacation homes are gone. But the damage they did isn't gone. Thousands of patients were used as pawns. Thousands of people who needed real medical care were treated like billing codes. Thousands of taxpayer dollars were stolen. Elderly patients in nursing homes didn't get the therapy they needed. Homeless people were exploited. Addicts were given more pills. Families lost loved ones. Patients underwent unnecessary surgeries. People were harmed. The system isn't going to fix itself. The DOJ is still investigating. More cases are coming. But the fraudsters are always looking for the next opportunity, the next loophole. The next government program with too much money and too little oversight. As soon as one scheme is shut down, another one pops up somewhere else. It's like whack-a-mole. The only people who can put pressure on this mess are the people watching this video. You, check your statements, talk to your neighbors, make some noise, share this video, call your representatives, demand accountability. Tell them you want the DOJ's healthcare fraud unit fully funded. Tell them you want mandatory prison sentences for medical professionals who steal from Medicare. That's how this stops, with you paying attention. Thanks for watching. I'll see you in the next one.